lost the focus on the field, on what you are doing. And with the microscope, that doesn't happen because the microscope doesn't move. And even if you move, you're never gonna lose the focus. When we work with loops, we need well, we have an extra cervical weight that we need to wear it, okay? The ergonomics in both cases or with both of them is gonna be better, okay? We are gonna sitting well, we are gonna have a better posture at work time, okay? And the ability of documentation, only with the microscope, you can make videos or photos of what you are doing, okay, at the same time.
The stabilization stage where we
and the illumination, okay. If you have some illumination with the loops, you need to put a lamp or something. And with the microscope, the illumination is coaxial, which is much better, right? So, and what is the importance of seeing more of what we are doing, right? So look at this picture of a very close-up of a preparation of veneer, okay? And look the importance of seeing what we are doing, okay? So if we can see clearly what we are doing, we can be more precise in the clinical. So we can obtain better results when we work with magnification, okay? Look the care of the tissue, look how how smooth the finish line it could be, okay, in these cases. Okay, look the integration between the ceramics and the tissue at this point. I'm gonna do a close-up of this picture and look at this. This is the integration between we can obtain between the ceramic and the tissue, okay? This is a beautiful case. I don't have the time, enough time to show you everything, but I'm gonna be specific and I'm gonna show you a full case in a few minutes. So remember that when we are talking about veneers, it's very important to preserve as much enamel as we can, because the adhesion in this tissue is much better than when we are talking about dentin, okay? And the survival rates are very significantly increased when intraenamel preparation are used. So when we are talking about the veneers, we are gonna try to keep as much enamel as we can. Okay, this is a very, very fast video of how it looks when we work or when I work with the microscope. Look how precise as I can be in this part of prepare the finish line, okay, at this cervical tissue point, okay. It is, you can work very fast and very, very, very right, because you are seeing everything what you are doing, right? So I'm gonna share with you this full case. I hope you enjoy it. I hope you like it. I'm gonna share with you the protocol that I use for handle these kind of cases. She's neat and she's she came to my clinic because she doesn't like her smile. She have an issue with the problem of the color that she has on the upper left central. Okay, she doesn't like this different color. She doesn't like the form of her smile, and she wants a change. Okay, so this is the protocol I follow or I use in my clinic. This is the protocol that I use for these cases. I take an extra and intraoral photographies. I do digital analysis. I do study models for the wax up and make the mock-up. Everything as I do at this point is diagnosis. Okay, it's very important to obtain all this information. Okay, to avoid problems with the case when we are working on. So this is the initial situation of the patient. Look, we can attempt a lot of things in this. Okay, so start doing this digital planning, digital analysis. This is an information that I'm gonna send it to my lab to make the first wax up. For example, in this case, look, we can make a difference in the tissue, in the margin, in the cervical margin, okay, in the architecture of the cervical margin, and we can improve better proportion of the teeth. So this information, I'm gonna send it to a lab, and the lab gonna give me a wax up with these characteristics. So I think the wax up in these cases, it's completely mandatory, okay, because we can make a lot of things through the wax up. So the first is the planning, okay. Even we can do functional planning with the wax up, okay. We can make the mock-up through the wax up, okay. We can know how type of preparation we are gonna do through the wax up. If the case is gonna be additive or subtractive, okay, that information is gonna be made by the wax up, and I can make the temporaries, okay, through the wax up. So the wax up give us a lot of benefits. So I think that it's mandatory that all the cases that we are made with veneers or crowns need this step. So already I have, or almost I have all the information that I collect in my diagnosis, okay, the pictures, photographies, the study models, the wax up, okay, the mock-up, then the patient approved the treatment, and then we have a treatment planning, right? So in this case, specifically, gonna do gingivoplasty, okay, to make a better gingival architecture. We're gonna make 8 veneers, calibration prep of the tooth 2.1, who is the central, who have the problem with the color, okay? I'm gonna use calibrated silicone index guides, and I'm gonna do a technique who is the driver mock-up preparation for the preparation for the veneers, okay? So the most important part of the treatment is the diagnosis. Is very important to collect all the information, okay? And then we're gonna have the treatment planning, okay? We start this case with the surgical part made by the periodontist of the clinic, who is El Dr. Andres Peñalba, who is a very, very great surgeon, okay? And this is the first part of the treatment to try to obtain a better gingival architecture. In this case, 8 weeks later, this is the results, okay, after the surgery, okay? And look how beautiful looks the new gingival architecture. At this point, we need to take new pictures, new models, and make a new wax up, because I have different position of the margins, okay? So then this is my second analysis. So I have a difference in these two centrals in weight and height. So I need to know that I'm gonna need to make a different type of preparation at this point, okay, between these two centrals, to make the space to the left, or make the space to the ceramist, to try to make an equal centrals, okay? So I need to make a different interproximal type preparation. We have 3 different type of interproximal preparations, okay? And and when I need to change the height and the width of this type of teeth, I need to go very, very depth in the palatal side and make the contact point. I'm gonna braid the contact point, okay, and I'm gonna I'm gonna do the contact point with the veneer. So I'm gonna open, okay, all the contact point I have in the tooth, okay, to make the space for the ceramist to can close this with the porcelain, with the ceramic, and have the opportunity to have the 2 equal centrals and try to solve that, okay? So this case I manage with I handle with the mock-up driven preparation. I'm gonna show you how the technique works with a video, okay? So we have the patient, okay? This is the initial situation after the surgery, 8 weeks after the surgery. So we are gonna put the bisacral resin with the mock-up, okay? You can do this with acrylic, okay? Already at the time we have the mock-up in the mouth, we are gonna start the preparation. So I use calibrated burrs like this one, who is a diamond round burr, okay, to calibrate to 0.25 millimeters. Then I'm gonna do these marks into the mock-up, okay? Remember, I have the resin, I have the bisacryl in the mouth of the patient, okay? Then I have another tooth, the upper left central, who have the problem of color. So I'm gonna do a more aggressive preparation, okay? So this is a calibrated board 4.5 millimeters, okay? look how I move my hand to respect the 3 planes of the tooth, okay? And then I'm gonna mark with a pencil the bottom of the marks, okay? And then I have my finish depth in preparation. So I'm gonna I'm gonna make a smooth preparation, okay? Try to erase the marks until I erase the pencil, okay? So this is the result after I erase the first marks I made, okay? Look at in the central that have the problem of the color. I eliminate all the resin, okay, all the bisacryl, and I already touched the tooth, okay? And in the others, that not happen, I still in the bisacryl. So that means that in the other teeth, the preparation is gonna be, or the restorative is gonna be additive, and in the central that had the problem with the color, I'm gonna be subtractive, right? So with a calibrated board, I'm gonna do these marks. I'm gonna paint this bottom, the bottom of these marks. I'm gonna erase this, or I'm gonna smooth these preparations until I almost erase the pencil. Okay, this is how the technique works. Remember that anterior teeth, or the thickness of enamel in anterior teeth, for example, in cervical, is very, very thin. Okay, maybe it's into 0.3, 0.4 millimeters of thickness of the enamel in the cervical area. So if we start prepare without the mock-up, okay, we maybe, or it's possible to eliminate enamel that it could be not eliminated. So put the mock-up and then try to be very minimal invasive in the preparation and try to preserve as much enamel as we can at this level, okay? So minimal invasion is exactly, that means this technique who I have the final volume of my restoration with the bisacryl resin, okay? And then this is gonna make me to minimize the buccal reduction, so try to preserve enamel at this area, okay? So then I remove the excess of the resin, okay? And very, very carefully start the smooth preparation, okay? I use this silicon index matrix to try to eliminate this incisal preparation, okay? The silicon matrix helped me to know if I have the ideal space for the ceramics, okay? So at this point, look how thin the preparation in the other teeth are, okay? And look in the central, with the problem of the color, I be a little more aggressive because I need thickness to the ceramic to erase or to balance the final color of the restoration, okay? Then I'm gonna put a triple zero cord, okay, very, very carefully with the tissue, okay? Remember that after that, we're gonna take an impression, so I don't want the tissue be bleeding or something like that. So very, very carefully put this first triple zero cord, okay? And after I put this, I have this situation, okay? So I have my first finish line preparation in the image of the left, okay? Then I'm gonna put my triple zero cord, okay? And I'm gonna have some retraction of the tissue. So I have a difference now between my first point of line preparation and the point of the tissue. So then I'm gonna move cervically or a little apically my line, okay? My finish line to this final point, and that's gonna make that the interface between the ceramic and the tissue is gonna be invisible, okay? This is why I put this first chord and then I finish my line. So this is how it works. I have my first position of the finish line at this level. Then I'm gonna put the first triple zero chord, and I have some retraction, and then I'm gonna move a little apically or a little cervically a finish line to this final point, okay, to have a better interaction or invisible interface between the ceramic and the tissue at the final of the case, okay? So this is the final preparation. I use the silicon index matrix to know I have enough space or sufficient enough space for the ceramic, okay? And incisal and buccal, okay? So remember that we can do minimal invasive dentistry without magnification. Look how thin the preparation is in all the teeth, except of the central that have the problem of the color, okay? But look how smooth and how thin the preparation is at this level, okay? Look how open the contact in the between the two centrals. Remember that I in the picture of the start, I know that I need to break this contact, okay, to give the space to the technician, okay, for make an equal centrals. Remember, like the final color of the restoration, it's it's determined by different factors, okay? The color of the substrate plus the color of the cement plus the ceramic system that we are using, okay? Remember that when we are talking about veneers, we have two different ceramic systems, who is feldspathic and this lithium disilicate, okay? This case is gonna work with feldspathic veneers. And I don't like that the color of the cement play an important role in the final color. So I prefer to handle these cases, making the space between the substrate and the ceramic system I'm gonna use. This is this is a start point, okay? So we need to make some space for the technician, okay, to the ceramic, to have the enough space for the final color. So we can take this information as a point of start, okay? That means that we need 0.3 millimeters of ideal space for each change in value group. So that means that if I have for example, in the central that I have the problem of the color, okay, like a 3M3, okay, and I need to go to a 1M1, okay, I need to have a 0.6 millimeters preparation to make the enough space, okay, for the ceramic. And then it's time for the impression. So I'm gonna put the second chord only for the retraction for the impression, okay? Be very gently with the tissue. I like to make this impression at first one-step technique, okay, with silicone, PDS, okay? Look the finish line at this level. I don't know if you can see my marker in the screen, but look how thin the preparation are at this point. So it's very important to work with the microscope or work with the loop. This case, I work with the loop, with loops, okay? Then take the impression, okay? Very easy step. Take your time for doing this. It's very important. Impression, it's good, okay? Then take the information that we are gonna send to the lab for the color of the substrate, because this information is very important for the ceramist, okay? So make the pictures and you can send this information to the lab, okay? We do temporaries, try to eliminate all the excess that we have on the temporaries, and that's gonna make that the tissue at the cementation appointment gonna be very, very healthy. Okay, remove all the excess. This is a great work from the technician Arturo Godoy, who is a great ceramist from Culiacan, Mexico. Okay, feldspathic veneers. Look how he handled this case with a stump shade in the central that had the problem with the color. Okay, look how beautiful the ceramic looked like. Okay, then I'm gonna do this the dry try-in to check the fit of the restorations, to make the patient approve, okay, this work, and then we go to cementation. Okay, cementation, it's very easy. Okay, we need to work with rubber dam. It's better if we work with rubber dam. Make all the conditioning of the ceramics, okay, fluoridic to etch. Be very careful with the time of the etching of the ceramic. Phosphoric for cleaning, saline, okay, and then go to cementation. The picture you see of the cementation, it's immediately after the cementation, okay. This is the result of the case, okay. Look look how the ceramics can be the artist in these cases. Look the effects that Arturo put in the incisal edge of this teeth. Okay, look how the margins or the gingival architecture that we obtain after the surgery. Okay, I really like to take control pictures 1 week or 2 weeks after the cementation, and look how I have a little excess of cement that it's very easy to remove. But we need to have this control to know that we are doing it's a great treatment or high quality treatment. So this is the final result, the result of the patient. Okay, this is the final smile. The patient is very happy with the final result. Okay, look the integration that we have or we obtain between the ceramics and the tissue. Okay, look at this. This is how I go a little apically when I put the 000 core at this level. Okay, to make this interface are invisible. Okay, like our natural tooth. Look the natural of the smile that the patient have, and this is the final situation. Okay, this is the final result. Okay, I really like what the patient needs or likes, the natural aspect of the tooth. Okay, not so white. Okay, this is the before and after. Okay, so we do or I do this smile makeover for the patient. Okay, we do we make grade the objective. Okay, look the size or the proportion of the centrals. Look the harmonize of the tissue. Okay, and this is how I finished the conference. So if you can see, if we can see what we are doing in dimension and quality, then we can be more precise. If we are more if we have more precision in what we are doing, our work will increase in quality. So details make big differences at this level. So thank you. I know it's very short time to try to share a lot of information, but I hope you like. Uh, I hope you like the case. Okay, this is a case I really like it, and I hope you enjoy it as I am.
Thank you, Professor Jorge. I'd like to express our thanks for taking the time to and share this important topic. Again, thank you, Doctor.
Thank you.
And now with Professor Ihab Sayah. And today's lecture will be additive or subtractive. Hope you all enjoy it. Dr. Ihab, the mic is yours.